was really excited when we opened the program here at the Overland Park campus. In working in nursing, I've had a lot of nurses I work with for a long time who said, I'd really like to go back and get my BSN, but most of the options were online, and they just did not feel like the online environment would work for them. They feel like they had to be in a classroom. And so to be able to provide this opportunity for someone to come be in the classroom in the evenings where they can make it work with their schedule, it's really going to open up a lot of opportunities for people who wanted to do this for themselves. As they start to grow, if they have a course, life changes a little bit. They can also take one course at a time, take a couple courses at a time. The fact that our program starts 3 times a year gives a lot of people options for, okay, it's not right now, but in a few months I could go ahead and get going and start on this process. And that's not an option everywhere either. It's, at most sometimes twice a year that you can get in and start those classes. We also run our program in 6 8-week sessions a year. So it's kind of nice to be able to focus on one class for about 8 weeks, get it completed and move on with it. And sometimes doesn't give us as much to juggle when we're already trying to deal with a full-time job, kids, family, and life. One of the things I find very unique about us is the fact that someone can actually do their prerequisite work and their other general education courses while they're taking their nursing courses. Most programs out there require that people have gone through, have all their gen ed requirements before they start the nursing classes. So that gives people a lot of flexibility. If they know this is what they want, they can go ahead, jump in, get started, and complete those other requirements as they go. Our program and all the legs that we have of it, so to speak, are based on Sister Simone Roach's 5 C's of caring, which include competence, commitment, compassion, consciousness, and confidence. And our nurses that, be it our newly minted RNs or RNs who are completing their bachelor's degree, have their base nursing education enhanced by that commitment to caring. And the 5 C's of caring really come in there with realizing that a person is so much more than their illness. And that's one of the things we really instill in our nurses, is that they're looking at the physical needs, the psychological needs, and the spiritual needs of our patients when we're taking care of them.